Hi everyone, Ann Lemons here. I am really excited to be with you today to discuss the differences between functional medicine and conventional medicine because it is Functional Medicine Awareness Month. Yay. So when I ask people what functional medicine is, I usually get a blank stare. So this is why I wanted to talk a little bit about this in a little bit more detail today, and why functional medicine might actually be a better option when it comes to chronic health issues. I have a really good visual on this. If you go back to my last post, it's a beautiful picture explaining the differences between conventional and functional medicine. So if you missed it, feel free to go back. So what's the problem? The problem is we are living in a chronic disease crisis, right? So today, 60% of Americans have at least one chronic health issue. 40% have two chronic health issues. By 2030, that will be 3 or more chronic diseases. And nearly 80 million Americans have an autoimmune disease. And this number is just going up. So that's problem one. Problem two is we've been taught that the cure comes from an outside source, right? There's a pill for an ill. So if you have heartburn, you're taking an antacid or a PPI. If you have anxiety, you just take an anti-anxiety med, right? So with conventional medicine, they're asking the question, what? What is happening? So then they take those collection of symptoms, signs and symptoms, they match it with a diagnosis. And then from the diagnosis, they prescribe a medication or surgery, right? So this works really, really well for acute problems. And having a husband in emergency medicine, I am really, really grateful for that. But for chronic issues, is there a better approach? So in functional medicine, we believe that the cure comes from within, okay? And that the body has an innate ability to heal itself if we give it the right guidance and the right tools. So in functional medicine, we're asking the question, why, right? Not just what, we're asking why. Why did that problem show up in the first place? And we're working towards a root cause resolution. So signs and symptoms are always downstream from an upstream problem. So we are, in functional medicine, we are upstream swimmers, right? So how do we do this? I've already mentioned that we're focused on the why and we're working toward root cause, but we're also, secondly, we're using systems and frameworks and tools to assess the problem and bring resolution. So we're using frameworks instead of protocols. So we're not just slapping a protocol because we take into consideration your bioindividuality. What is right for you and your body. And thirdly, we're working in a therapeutic partnership, right? This is somebody that's willing to be in it with you and work through that clinical process and allow it to unfold to give us the information that we need to move forward. We're listening to your story. We're listening with empathy to really understand what is happening. So in summary, we are focused on the why. The functional medicine practitioners are focused on the why, not just the collection of signs and symptoms. And we are respecting the bioindividuality and treating within frameworks, not protocols. And then lastly, we're working in partnership, in a therapeutic partnership with the patient, because we believe that most chronic conditions, we can get the cure from within. We have that ability to heal ourselves with nutritional and lifestyle strategies. We can do a lot to live a much healthier and vital life. So please feel free to share this video with someone you think that would benefit from it, and we will see you next time.